Rob, thanks so much for joining us.
Hey, nice to be here. Happy to be here, Keith.
I'm excited to talk to you because we're going to talk about HealthEdge, which is on a mission to drive a digital revolution in healthcare. So let's unpack that. What does that mean?
Healthcare is as many people have experienced in the United States, um, not as digitally forward as it could be. I think there's
True.
a lot of older systems, a lot of older processes, a lot of, companies relying on mainframes to do claims processing and, forms and paperwork and faxes. So it's really one of the last industries where we've seen widespread digital transformation. And what that means is the consumer experience suffers. We deal with a lot with insurance payers and we update their claim adjudication system and their clinical care management systems. And we bring a lot of automation, a lot of efficiency. And what that enables the insurance payers to do is really bring some more digital consumer-facing experiences and improve the efficiency of how they interact with their customers, which is all goodness, right? Like we provide digital transformation for the company. The company then is able to provide digital transformation for their consumer, and then we sort of bring the industry along and help digitally transform the healthcare industry as a whole.
And you're touching upon something that I was going to ask you because the healthcare industry is so complex with different parties. So who's the primary customer? And like you kind of just relayed like a B to B to C model that's kind of happening too.
Yeah, so we deal with insurance payers. So payers are when you go to the hospital, we call it a provider or any clinician, or you receive some form of treatment that's covered by your insurance plan. The provider submits a claim to your insurance company, or if you're insured through some other vehicle, like maybe there's a union or an association or a group of people, or maybe a company that's self-funded, the claim goes through that process, gets adjudicated, and then paid. And what we don't say is insurance companies, because it's not always an insurance company. So the broader term is payers. And what we help is these payers. We help them adjudicate those claims more efficiently. We have like a 95, 96% auto adjudication rate, whereas previously someone would have to look at the claim, open it up, compare it to a bunch of rules. We can now get to like 90, 95, 96% auto adjudication rates through our system. And then we have some pricing and editing tools which help make sure that the bill is the right bill, that there isn't overcharges from the hospital or they haven't coded it incorrectly. And then we have some clinical tools that help in the care management aspects. If you're an insurance company and you have some degree of your population has chronic conditions or they're receiving long-term treatment for a condition, the insurance company will assign them a clinical staff called care managers that will help make sure that they're checking in, that you're taking the right medication, that if you're on an exercise or diet plan, that you're still, complying with that, and that they're assessing you along the way. So we help the payers with those two core areas of their business, the claim side of their business and then the clinical care management side of their business.
Now you recently joined the company as its CTO. So what brought you to HealthEdge?
I think this desire to be part of this massive transformation in healthcare. Like I remember, I took my son to the pediatrician who was having some breathing issues. Right, he'd been sick for maybe a week, and he was having some breathing issues, and they said we need to get him to the ER really quickly. He's having like almost an asthmatic reaction to a viral infection. And I was very explicit with them, and I was like, I'd like to go to NYU Langone, which is, a very good pediatric care hospital with a pediatric ER. And the provider and the emergency medical team started having this conversation about like insurance coverage and like, different decisions and approvals. And, it's such a weird thing where you're in this situation where you're with your kid, you're trying to make it the right decision for your kid, but then there's all this like background noise of, is it covered? Is it not? Am I going to have to pay more? Am I going to have to pay less? Like, am I going to do this? And like that really shouldn't happen, right? Like in theory, you should be able to make a care decision for yourself, for your family, and you shouldn't have to worry about all of these other ancillary things and paperwork, and you should be able to get real-time information to you. And then when you do get billed, it shouldn't be a surprise, and you should get the right bill. And like I think joining HealthEdge we're in a unique position in the industry to really help improve that and really help improve the user experience of dealing with healthcare and health insurance.
No, there's definitely a lot of room for disruption. And what's great about HealthEdge is it's a company that has solid footing. It's been around for a while. So what is like kind of the next phase for HealthEdge?
I mean, it's sort of cliched to say AI, right? Like I think you probably have a lot of these interviews, and everyone's talking about AI. But when you think about the healthcare industry, and you think about the amount of knowledge you have to consume to understand plans, to understand where you can go for the provision of care, where you can and can't go, that's in network and out of network. I mean, it's this really like massive amount of rules and massive amount of information that you have to try and consume. And one thing that a lot of these generative AI tools is really, really good at is summarizing large, unstructured, disparate sources of information, and for you to be able to have natural language interactions with that corpus of information in a way that is sort of, consumable by you and understandable by you. And I think there's a massive benefit to us and also our payer customers of deploying AI and helping consumers really understand what's going on. What did they sign up for? What are they about to get charged? How do they get charged? How does this work? So I'm really, really bullish on the ability for us to actually meaningfully deploy AI. I think a lot of companies have the AI just as a sticky note, and they're trying to figure out like what does that actually mean. I think for us, when you just look at some of these health insurance plans that people sign up to, they're sometimes impenetrable. When you look at the amount of data that you have that has implications about whether you can get treatment A or treatment B, I think there's a massive opportunity for us to bring a lot of clarity to the consumer experience there using some of these generative AI tools. And then also to enable our customers, the payers, to understand more about the data that's in the system. They have vast, vast amounts of data about their customers, about their patients, about their providers, and it can be sometimes impenetrable. And AI is great at making impenetrable data sources understandable.
Yeah, it's such a perfect use case for AI. There's no doubt. So the culture at HealthEdge, what's it like working there?
HealthEdge is an amazing company, and it's one that's going through its own transition too. You know, we acquired HealthEdge was the original company. We acquired three other companies. So we're really bringing these three companies together to create a HealthEdge platform. And there's a tremendous amount of enthusiasm around that. But there's also different pockets of knowledge and different pockets of expertise and a real sort of cultural melting pot of approaches and diversity of thinking. So I would say that the company is very, very empathetic, very passionate, very innovative and forward thinking, and also just a great cultural diversity, a place where you have a very diverse set of cultures. And it's also at an inflection point in creating platform level technology and platform level services. So there's a tremendous vibe and a tremendous buzz around that, right? That everyone's really excited about doing things four ways, taking it down to doing it once, really building a platform that's going to take us into the future and really building a platform that from a development experience perspective is world class and enables us to attract and retain world class talent to work on the latest tools in an environment that just favors rapid innovation and rapid deployment.
Now, regardless of market conditions, top tier talent, they always have options for their career. So why should HealthEdge be on the radar for job seekers?
I think if you want to make a real difference and a real impact, this is a great place to be. I think not just from the impact that we're making on the industry, and also the impact that we're making on our customer engineering teams and our customer teams, but also just the human aspect of this. At the end of the day, if we make this a better world from an insurance perspective and a healthcare perspective, we can have a real impact on people's lives. And, we can make our health insurance companies more efficient at processing claims, which means they get better deals from the hospitals, which means the cost of insurance goes down. We can help improve clinical outcomes with better care management. And what a great place to be. I mean, it's, not a company where the impacts of our actions are unseen in the industry.
Well, if you are interested in exploring opportunities at HealthEdge, you need to go to their company page on VentureFizz, which has all their job listings. Go to venturefizz.com/HealthEdge and you'll see their listings there. Rob, thanks so much for bringing us up to speed on all the great things happening at the company.
You're welcome. My pleasure.